Hi, my name's Evie. I'm one of the urology nurses. I work at Royal Melbourne Hospital and the Australian Prostate Centre. One of my main jobs is educating and supporting men like you and their partners with prostate cancer, and I run sexual function clinics looking at helping to manage sexual dysfunction and treatment options that are available. Getting a diagnosis of prostate cancer can be pretty overwhelming for patients and their family, but there is a lot of support that's available for you. So there's urology nurses like myself that are trained in looking after men and their partners with prostate cancer. There's also prostate cancer specialist nurses that have been funded through the Australian Prostate Cancer Foundation, who are located throughout Australia in both public and private hospitals. The nurses that are available to support you through this whole process can help you discuss your treatment decisions and also coordinate your care throughout the whole pathway of treatment. Make sure you've got all your appointments and link you in with specialists that you might need to see. Okay. They can provide education and management, or we can provide education and management to you about the side effects and ways to treat the side effects from prostate cancer treatment. Your GP is also a fantastic resource if they're well educated in regard to prostate cancer and treatment, and they can help you out with that as well. Also, support groups are a fantastic way to get some support because it's one thing to have clinicians and nurses give you education, but it's quite another to get that education and support from people who've actually been through prostate cancer diagnosis and treatment themselves. So the Australian Prostate Cancer Foundation of Australia have around 150 prostate cancer support groups located throughout Australia in both metropolitan and rural areas. And so you can locate them on the website. Otherwise, you could call your urology nurse and they can help you out with finding one close to where you live. The other option is there's a lot of patients out there who have that don't have an English-speaking background. So the Prostate Cancer Foundation actually have support groups for languages other than English. And also there's a lot of men out there who are gay who have a diagnosis of prostate cancer and bi, and also transgender, so men that have transitioned to women who develop prostate cancer as well. There's actually a support group specifically available for those patients. And you can locate that support group through the Prostate Cancer Foundation website as well, or speak to your urology nurses to get a contact number. There's also an online forum for patients who live quite rural. It can be quite isolating for you to have that diagnosis of prostate cancer, and you might not have as much support potentially that's as available as what's in the metropolitan areas. If you're computer literate, there's a community news forum that's on the Prostate Cancer Foundation website that you can actually talk to other patients as well, and rather than actually coming into a support group if it's too far for you, you can even just chat online with them. Psychologists are available to also support you throughout the whole path of having prostate cancer treatment, because it can be quite distressing for you. It also can be distressing for partners. When you've developed prostate cancer, the partner can be distressed as well, and can actually be more distressed than the patient themselves. So it's important to often talk to your partner if you've got one, just about that there are psychologists and support available for them too. If your unit or the hospital that you're going to doesn't have a psychologist available, you could see your GP and get something called a mental health plan to be able to see a psychologist in the community to be able to help support you throughout the whole process. Another thing too is coming out a lot more is exercise being important for your general health and well-being, and you can also see exercise physiologists out in the community, and your GP can help refer you to one as well, and you can get something called a team care arrangement, which can help reduce the cost for you of being able to see them out in the community, and they can provide you with a tailored exercise program to help throughout your treatment, to help often with side effects. So with hormone treatment, exercise can really help with managing the side effects from that treatment. Ideally, you should be seeing a continence physiotherapist before you have treatment for prostate cancer, having your prostate removed. You can speak to your urology nurse or your urologist about getting a referral through to a continence physiotherapist, and they can teach you how to do pelvic floor exercises and help you, help recover your continence following treatment for prostate cancer. It also helps with erectile dysfunction. So if you're thinking about blood flow is really important for erectile function, so exercise can help with erectile function as well. Sex therapists and intimacy consultants are also available, so you can find them on the internet, or you can again speak to your GP or your urology nurse or your urologist if they know anybody that you can speak to and get a referral to get some guided counselling in that area. And also speak to your partner and peers. Rather than holding everything in, I would really encourage talking to the people around you and your close family and friends about your diagnosis and about your fears and what you're thinking moving forward. And they should be able to provide some support for you. And if you feel like that's lacking, then definitely get in touch with your nursing or urology team to be able to help support you in the future.